Greeting, ladies and gentlemen. My name is Pauline, and I'm the Vice Chairperson for IBC. It is my pleasure to welcome you to the 5 Minutes Healthcare, an initiative from the IBC Health Working Group. I would like to introduce Dr. Reginald Liew from Parkway Hospitals Singapore as our guest today. Dr. Reginald Liew is a Senior Consultant Cardiologist, and he will be answering a series of questions on heart health over the next few weeks. Could you please answer one final question? The importance of health on work-life balance. How can we live a healthy life?
Yes, thank you, Pauline. That's a good question to end up on, because ultimately that's what we all want. We want to lead a healthy life. We want to have a good quality of life, but also be able to enjoy the job that we are doing, but in a safe and healthy way. So ultimately, the most important thing, as the old adage goes, is prevention is better than cure. So if you have the risk factors for heart disease, but haven't yet developed heart problems, better to reduce the risk factors and control those. So if one is overweight, obesity and being overweight is an important risk factor. And as we all know, we can reduce obesity by eating more carefully, reducing carbohydrates, reducing a lot of the high fat foods that we eat and dairy products, and also by exercising more. You know, all doctors talk about exercise and having a more active life. It really does make a difference. So the current international recommendation is that we should really be exercising at least 3 times a week, ideally aim for about 150 minutes in total of moderate intensity exercise. So it's 50 minutes each time, or say 5 times, 30 minutes. And that will really help us to lose weight. It'll help improve our blood flow and reduce blood pressure. And exercise generally improves our general well-being. The endorphins that are released during exercise make us feel happier and make us feel more relaxed afterwards. So I would say keep weight down, eat healthily, exercise regularly. And for those of us who have other risk factors such as smoking, very, very important to stop smoking. It really does make a difference long term. And people with diabetes or pre-diabetes, important to again reduce sugar content and carbohydrate content, and have your blood sugar checked regularly. So those are more the preventative side of things. Then of course one can take active steps to actively look for underlying heart problems, because unfortunately some people, despite having a healthy lifestyle, can still have heart disease because of genetic reasons that they may not be aware of. So I always recommend people to have a heart checkup. You know, ideally, if you have any risk factors or symptoms, or particularly in men above the age of 50 or women above the age of 55, I do recommend a general heart checkup, a simple check with a doctor, check blood pressure, check blood tests, and check ECG. The doctor may then recommend a treadmill test or other screening tests that can pick up early heart problems. So ultimately, it's a combination of everything to have a healthy life, reduce all the risk factors, and regular checkup. But ultimately, to answer your question, how do we lead a healthy work-life balance? I often say to my patients that it's good to work hard, but also good to rest and play. So they should sleep well. They should make sure they try to get at least 7 hours of sleep at night. Have time to relax and wind down from a busy day, because otherwise your body will be constantly, you know, on high alert, and you'll have your blood pressure will remain high unless you can wind down and find ways to relax. And you know, doing that will really allow you to work more effectively in the long term. So very good to have a good work-life balance, but you know, have regular checkups as well.
Thank you, Dr. Liew, for your views on how we can live a healthy life and the importance of work-life balance. It's been a pleasure working with you, Dr. Liew, on the 5 Minutes Heart Health initiative from the IBC Health Working Group. If you do have any further questions, please do not hesitate to contact Dr. Liew from Parkway Hospitals Singapore or contact IBC today. Thank you so much.
Thank you, Pauline.